one of the interesting things about facelift surgery is that there was a company that tried to commoditize facelifts. So when I came out of my training, I finished in July of 99. I was trained to do facelifts and I only did them under general anesthesia. And I had good skills and I could do brow lifts, I could do blepharoplasty, I could do a chin augmentation. So here I was with all these skills, but patients were going to this place called Lifestyle Lift because they marketed much more than I did. And they tried to commoditize that operation. So they had lots of advertisement and they would get people to come to these centers, usually in strip malls. They would have somebody who had an incentive to sign the patient up. They would just say, you need a facelift. And then that person, if they signed up, would get a commission. So they had a lay person determining who was going to have a facelift. And then that person would get a commission. So of course they want everybody to have a facelift. And then they would get a surgeon who they taught quickly how to do the surgery, usually with a video. And then if there was a problem, that surgeon wasn't around. It worked for a while and they captured the market. And then they went down in flames. There was so many lawsuits, so much malpractice that they had to go bankrupt because facelift surgery is too hard to commoditize. And if you try to commoditize something that is so delicate, you're going to get burned. And so if you go out and try to make facelift R Us, and then you're going to get everybody to come in and have surgery and you're going to offer a discount and you're going to get a bunch of people to do it on the cheap, you're going to have problems. And it just didn't work. So facelift surgery is hard. And I like it that it's hard because, as people used to say in my training, it keeps the tourists out of it.